Hello, I'm Kenneth Cutbush, a shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physio, and we're talking about the rehab for someone who's had a fixation and a fractured clavicle which has been fixed surgically. So if you've broken your clavicle and you're worried about whether you need surgery or planning on having surgery, this is what you need to know that you're going to go through after the operation, and it's something to consider when looking down that path. So typically, clavicle fractures I will fix through an open approach with a plate on the clavicle. We use anatomical clavicle plates. These plates are specifically designed to go onto the clavicle. They're low profile, and invariably they don't need to come out. And they're very strong. They can be titanium or stainless steel. I tend to prefer the stainless steel ones, surgical grade stainless steel. And you'll have an incision across the front of the clavicle. You need to be aware that you'll have a little numb patch under that because the little skin nerves coming through will be divided by the incision, and so often a little numb patch. Over time, that will get better and go away. You are often in hospital one night, and the next morning you'll see the nurses. They'll check your dressings, and the physio will see you as well. Now, what's the physio going to do with someone after they've had their clavicle fixed?
So we're going to help make sure the sling fits nicely. You can wear the sling when you're out and about, when you leave the house. But if you're at home, just quiet sitting, you can have the sling off and rest your arm on a pillow. The physio will also make sure that your adjacent joints aren't going to stiffen up as a result of being still. So we show you some range of motion exercises for your hand, for your elbow, and for your neck. And we show you some gentle passive range of motion exercises for your shoulder. So a gentle pendulum, just letting your arm hang away from your body in order to be able to wash and dress. And then we also show you some external rotation. So because you'll be in an internally rotated position in the sling, we stretch out into some external rotation to make sure you don't stiffen up too much. So it's all pretty low key while we're waiting for that bone to heal.
Yeah. Now, invariably, the fixation will be good. You'll have an x-ray before you leave hospital. And invariably, I'll be saying to you that you can have the sling off when you're at home, just doing quiet things, watching TV or taking it easy, and you don't necessarily need to wear it at night time. But I'll be usually asking you to wear the sling when you leave the house for the first 6 weeks. It's a good visual indication to other people that you've had surgery, and just avoids issues with the shoulder. So we'll be seeing them back at 6 weeks with an x-ray. What do we do at that point?
So you look at the x-ray and advise us as to how it's healing.
Yeah, and invariably it has united, and you can see callus on the x-ray, and that's going to be it from the point of view of the clavicle fracture.
So then we can start rehabbing the shoulder girdles. So we start doing some stretching of the shoulder, address any joint stiffness that you might have from keeping it still while it's healing. And then once your range of motion comes back, we start some strengthening. So getting the strength back in your rotator cuff and scapular stabilizers, and then progressing towards some sport-specific or work-specific tasks.
Or back to footy. So 6 weeks is usually it in terms of the rehab. Normally the clavicle's united. Normally you'll have your range of motion back or very close to full range of motion at 6 weeks, and you'll be starting straight into return to sport or return activity exercises or going to the gym.
Yes, once it's healed, there's no real time frames. You just go at a speed that your shoulder's happy. So it's nice. You can hit the ground running. Yeah,
and this most clavicle fractures are treated conservatively without surgery. The clavicle fractures we're talking about are those where there's been where the clavicles have overlapped 2 to 3 centimeters, and they, particularly if you look short on that side, because the clavicle struts the shoulder out, and the shoulder will tend to collapse in a very small number of clavicle fractures. And the other ones where the fracture is grossly displaced, so there's a big distance between the two. Generally, the literature favours fixing those clavicle fractures over leaving them alone, but that's something that your surgeon or I will discuss with you. And the other group of clavicle fractures that tend to be fixed, the ones that fracture right out towards the shoulder, because they're then complicated by the ligaments around the acromioclavicular joint, and they often don't join up very well. So those are the other ones that you'll be have a discussion about fixing. So otherwise, if it's just a straightforward clavicle fracture, we're not talking about surgery. So if you've broken your clavicle and there's been discussions regarding surgery, this is what you need to know that you're facing down the track after that operation. You need to be aware of these details and the rehab you're going to be going through. Thank you for listening.